Hi, I'm Dr. Hyland.
I'm Bob, Janice's husband.
Nice to meet you.
Hi.
Hi, Doctor.
Karen, your mother's nurse.
Oh, hi, Karen.
Nice to meet you.
Mrs. Saunders, how are you holding up today? I imagine this is a difficult time for you and your family.
It's been a really rough few days. I am really worried about my mom. Please call me Janice.
Okay, Janice. Yeah, I'd like to talk to you more about your mom and your mom's condition, but can we start with having you tell me what your understanding of your mom's current condition is?
Well, I know that she developed pneumonia, and it got so bad that her lungs failed. And then she had to go on this breathing machine to help her get enough oxygen.
That's correct, and we'll go into some more details about her condition and some treatment decisions that need to be made today. But before we do that, I just want to clarify something. You know your mom's so sick she has the breathing tube in her mouth, so she can't speak for herself. My understanding is that she's asked you to help us make decisions today. We call that a substitute decision maker. Are you comfortable with that?
Yes.
Oh, good. You've been to the My ICU Guide website and got the My ICU Guide questionnaire here. That's awesome. This will be really helpful to us to be sure that the treatments that we offer your mom are consistent with her values and preferences.
It was good to go through the questionnaire. It helped me think about a lot of things, and it gave me ideas about some things I should ask you about.
Well, I'd be happy to answer those questions, but maybe we could work through this together. So it gives me a chance to get to know your mom here a little bit. I see that you note here that she was quite frail and maybe struggled to get around before she came into hospital.
Yes, we were just starting to talk to her about assisted living, but she wants to stay in her own home as long as possible.
She's quite stubborn. She loves her independence and hates to have to ask for help.
Well, I know that can be challenging as people get older and need more support, but it sounds like maintaining her independence was important to your mom.
Very much so.
I see here that you've noted that many of these health conditions would be unacceptable to your mom, such as being confined to a bed or unable to look after herself, and that the medical treatments that we should be offering should be focused on preserving the quality of her life and not prolonging her life.
My mom is 83 and very frail, but she has always had a good quality of life with family and friends. Maintaining her independence is really important to her. My father died 20 years ago and Mom's been alone. You know, she's not afraid of dying. What she's more afraid of is being alive and not being able to look after herself.
That's very helpful. Thank you for sharing that insight. I want to say that your mom is stable right now, but her organs are showing signs of injury. And if that injury persists, it's likely she'll have a prolonged stay here in the intensive care unit. And if she survives, then she will be weak and debilitated and probably unable to look after herself and need to go to a nursing home.
She would hate that. But she can't stay at home. There's no one in the family who can look after her. We're all still working.
Yeah, no, I understand what you're saying. If her condition were to worsen and her heart were to stop, we need to talk about aggressive measures like cardiopulmonary resuscitation or CPR. Do you know much about that?
I watched the CPR video on the My ICU Guide website. It doesn't look like she would benefit much from that procedure.
About 1 in 100 patients like your mom and your mom's condition would survive to hospital discharge. And then again, there's a risk of that there would be some impairment to her thinking or her memory or her ability to look after herself again. So based on what we're seeing on this report or what you're telling me, it doesn't seem like that's something that's in your mom's best interests.
No, not at all.
Yeah. So I think what we're saying today is that if your mom's condition were to worsen to the point where her heart were to stop, that we not offer cardiopulmonary resuscitation, that we allow nature to take its course, that we focus on comfort. Do you feel like that's consistent with your mom's values and preferences?
Yes, I think so.
Okay. Do you have any other questions or concerns that you'd like to discuss with me at this time?
No, not now.
Well, thank you. I know this is a difficult decision-making process, but it's been very helpful that you went to the website and educated yourself and filled out the questionnaire. This has been helpful to us to get to know your mom and know that the treatments that we're providing are consistent with what's best for her. So thank you for your time, and appreciate it very much.
Thank you.